Hello, and thank you so much for joining me at 40 Cador Street, Tea Time. I know it's been a long time since I've invited you to listen to something I thought I had good to say to you. I don't come in here very often. When I do, I always hope that it's a message that people are going to want to hear. I want to talk to you today about ageism, and not just for seniors. Most people, you say ages, and they think, oh, old people. And I guess that's a good assumption because you talk about old people, you talk about ageism, but sometimes it can affect young people equally as much at times. And I say that because people don't look at it like that. When you say ageism around young people, they think, oh, old people, senior citizens. But here's the bottom line: you might be closer than you think to ageism. If you're more than 30, you better start planning. Then let's think about young people, for example. A young person goes to college. Sometimes they go straight through, do 8 years, get their bachelor's, their master's. They come out, they want a job. They apply for jobs and they don't get hired because they're too young with no experience. That is a type of ageism, how people are being pushed away because of their age. So that's an example of young people being affected. Now let's talk about senior citizens, and mainly those who end up in state-ran nursing homes or facilities like state-run mental health facilities. So many of the people who are in those situations are on chemical straitjacket drugs. Now, what do I mean by that? It means that there are many psychiatric medications that are given to seniors who are incarcerated in mental institutions and state-run facilities, nursing homes, etc. There are many. And how do you take care of those people when you don't have enough staff? You medicate them with chemical straitjacket drugs. And sometimes, for some reasons, younger people get in those situations that are in a nursing home because of a disability, an accident that took things away from them where they can no longer be at home and they don't have family. They fall into those categories also of ageism. What are we going to do about that? In a few weeks, I'll be 74. I'm not too worried about ageism for me because I'm not going to a nursing home. That's not my plan. And that's because I planned for it. You have to plan for where you want to be, especially if you don't have children to help you out. And even if you have children like I do, I don't want me to be a burden or my husband to be a burden on our children. Never that. So we planned for how it's going to work out for us. The government did a study recently, I think in 2020 maybe. I'm not absolutely sure, but they found out that 1 in 9 seniors in nursing homes were on some type of chemical straitjacket drugs. How do we prevent that? What do we do about it? Who knows? The problem was when the pandemic came along with COVID-19, many occupants and people in those institutions died with COVID. Why? Because there was not enough staff, not enough people to take care of them. They were medicating people and maybe medicating them too much. The United States Supreme Court heard arguments in November of 2022 about a case that may decide whether millions of long-term care residents have the right to sue state-run nursing facilities in certain circumstances. Is your senior loved one in a nursing home or a mental institution that's state-run, or in a prison system that's state-run in those facilities where they have those compartments or those places where those kind of prisoners are held? People are prisoners for whatever reason or whatever they've done, but they need to be treated as human beings regardless. Again, how do we do that? How do we fix it so everybody's being treated fairly across the board, especially since there's not enough staff to take care of all these people? We're in no better situation than we were 20 years ago with people in nursing homes. Some of the things I can say to you, if you're a person who has a loved one in a nursing home or any other facility that you can visit often. Because when my father was in a nursing home, My sisters and I found that when we visited him, often he was taken care of well. We did it in terms because there are quite a few siblings I have. One of us did laundry, one of us went to see him and talk to the doctors, one of us was the point person. You just have to have some kind of plan. If you have children, who's going to do what? Because I found that the more we visited, the better care he got. I would go in there and see so many other people, residents, clients, strapped in wheelchairs, slobbering with bibs on them, obviously medicated, and just sitting there. Just sitting there. It's sad and it's sickening to see. And it bothers me a lot because I am a retired nurse. I have a lot of feelings when it comes to patients, residents in those situations because I've worked many of them. I can't fix it and you can't fix it, but we can all help. So if you have people in there or people you love or friends that you know and are in a nursing home or they're in prison, go visit them. Visit them. Don't just pretend that they don't exist. Don't do that because it could be you. I find also, in not just talking about seniors, when we talk about chemical straitjacket drugs, I did foster care for many years with my husband, and we got many children that came to us on so many different straitjacket drugs. I mean, so many that you couldn't possibly know which one was doing what for that child. My husband and I fought really hard through the system getting kids off of those kinds of drugs. Somebody has to be the advocate. If you can be an advocate for a young person, a senior person, just a friend, not a friend, a relative, whatever, step in and help those who cannot help themselves. The use of psychiatric drugs are very harmful to seniors. They can increase the mortality risk highly. That's why we lose many patients. Of course, the nursing home and the doctors who go in when they're pronounced dead call it ageism. They died of old age. Come on now, do the math. Just because you're a senior doesn't mean you're just going to die from old age. But if we are put in places like that where nobody cares about us and they need to have you quiet so they can do their day's work on their 8-hour shift or 12-hour shift, 10-hour shift, whatever it is, that's what we're going to do because they have to survive. The workers have to get through their day and take care of those they can take care of who still have something upstairs that they're working with. That's the problem. Everybody's not working with the same thing, and then you got to worry about when they're older, Alzheimer's, dementia, so many things. But the senior should not be penalized for that because something that can happen and it's natural. State care facilities could face lawsuits, and they should if they don't get it together. I don't know what the plan is. I don't know how they're going to get it together, but they need to get it together. Ageism is also in our workplace. I mean, there are many seniors working and are fired from their jobs because they can't keep up. They're slower now. They're costing the company too much money, so they hire somebody younger to get rid of them. That is not fair when you put your time in and you can do the job. You don't have to be as quick as the young person as long as you're thorough and doing your job. But companies want to save money and they do it however they can do it. It doesn't matter about you. They don't care about your feelings when you're an older person. Why is it so accepted to perpetuate stereotypes of Americans in this country? It is not fair. The seniors are not ill and out of touch. 118 million Americans are over the age of 50. If you're not thinking about ageism, you better start listening and find out what's going on with ageism because you're right there in the midst of things. Maybe you're happy, you think you're young, you're working, you're making your money, you're doing what you want to do, but if you live long enough, it's not going to stay like that. It's not. I mentioned state-run institutions, but I haven't talked about the independent private institutions. Oh, yeah. Let me tell you a little bit about them. Here, have your sip of tea if you need to. In those independent private institutions, they are not watched. They're not watched as seriously as the state-run places. So you need to pay attention, especially if you're paying your money out, big money for your parents or yourself in these independent places, private, because they can get away with a lot of things. You may have heard about the Texas elder murders in Dallas, Texas. Please do Google that one. It is about a lethal strain of ageism that led to the deaths of more than 20 innocent older people, 20 women and one man. The Texas authorities now believe that the chemical straitjacket drugs killed these people. Older residents were robbed of their belongings, of their money, and among them, they're in their 80s and 90s. And most of those people really don't have it that much together where they can watch every little thing about themselves. And maybe at that age, they might not have many relatives living still. So again, I revert back to what I said earlier. If you know someone, you have a friend of someone, a family, a member, and you can go visit them and find out what's going on. If you think something's not quite right, guess what? It probably is not just quite right. Ask questions. Pay attention. The study says, in spite of the information they got pointing to those deaths and the evidence that they had, the medical records, the medical examiner said all of those deaths were, listen to this. Now, let me sip this tea. Wait a minute. Eight of those people who died were in the same facility. They were written as death by natural causes. Come on now, do the math. Do the math, y'all. Look out for yourself. Look out for where you're going to be later. Because you might not be always in your house, walking up down the stairs, going to bed, and doing everything on your own. One day, something could happen that changes your life forever, and you might end up in one of these facilities. Be prepared not to lose your life to chemical straitjacket drugs. Lethal ageism persists, really subtle today. Sometimes it's hard to pick it up, but it's there. Pay attention. You always have to always be on your toes and pay attention, because sometimes things are right in front of your face. And again, I'll repeat, if it seems like something's not right, guess what? It's probably not. It's not right. Check it out. Protect yourself. Protect your family. And because of COVID, many mothers and parents are taking care of their younger children. They're in nursing homes and facilities like that because they can't take care of themselves anymore for whatever reason. And as y'all know, young people die twice as much as old people nowadays. They do, for many, many reasons. Be prepared for everything. And since we're talking about being prepared, let me say one other thing. Doesn't quite fit right here with what I'm going to say, but I'm going to say it anyways because I'm feeling that right now, okay? Seniors, older parents, younger parents, be prepared. Stop not protecting yourself with life insurance, dying and letting your kids have to beg on Facebook and social media, GoFundMe, to get money to bury you. Take care of this. You should be doing this. It shouldn't be left to your children. And young people, if you're out there making the big money, $100,000 a year, got your college degrees, and your parents helped you get through there, think about this. It's called generation insurance. You know your parents don't have an insurance, go on and get that because you're making enough money. Talk to them, of course. It won't be behind their back. You're telling them that you're going to get a policy, take care of anything if they pass before you. Do that and pay that policy so you can stop begging family members and friends and strangers for money to bury your kinfolk. We have to be more accountable. We're not doing that. I would say since COVID, my husband and I have donated to so many different people's funerals we don't even know. Because you feel like, oh, I got to put something in there. I got to put something in the kitty. Come on, y'all, let's get accountable. Get accountable. There are so many policies that you can get. And you think your children don't die before you? Look at the math. Look at TV. How many young people are dying? Look at the school shootings. Look at all those things that you can't predict when something like that is going to happen. You need to have insurance on your children too. As sad as it is, you need to do that because you just never know when your phone is going to ring and say your child is dead. I had that experience. a knock on my door telling me my child was murdered. So let me tell you, be prepared. He was prepared. I taught him that. Teach your children and yourselves to get on board with doing something so you're prepared if you take that last breath. Stop leaning on your family and leaning on the system. It's unfair. And yes, I'll be the first to tell you that life is not fair. All right, I got that. Life is not fair. But you can help out a little bit. You can help out. So I kind of got off track a little bit because sometimes my brain just goes all around the place. I'm looking, oh, let me cover this, let me cover that. But let me cover the things I wanted to cover. I am a senior citizen. I'm definitely over 50, over 60, over 70. It's all good. I'm hanging. But I'm prepared. And I'm not going to a nursing home. That's not going to happen. So you need to be prepared. If that's not where you want to end up at, figure out what you're going to do or where you're going to be. Who's going to be in charge? Get those living wills. Get it in place. Don't end up in the hospital on life support and nobody can make a decision. Don't do that. So now that I taught you about ageism and getting old, I hope it didn't scare you. But if you live long enough, you're going to be as old as I am. I might not live to see that. But if you live long enough, you're going to be as old as I am. So you need to be prepared. Okay? And live your best life every day. Every day, live your best life. And enjoy tea. Green tea, black tea. It doesn't matter. Enjoy life each and every day. And I say to you, all of my followers, fans, and friends, thank you for stopping by 480 Cador Street. I appreciate your company. Until next time, bye.